Hi, everybody. I'm back. I'm sorry I've been a little absent, but I am going to be better about posting and providing any information that I feel that could be helpful in your journey. Again, my channel is really going to be focused on my cancer journey, but I'm also going to expand that to my fertility journey because it's kind of all interconnected. Um, so I've talked about, my initial diagnosis, and kind of how all of that came about. Um, and so I decided to go back a little further and kind of talk about my fertility journey. We began having fertility issues really back in 2019. We had been trying for 2 years with no luck. One of those years being like really closely tracking ovulation cycles, using, the ovulation sticks to determine when I'm most fertile, et cetera, et cetera. So we then decided to meet with a fertility specialist. I went with Boston IVF at the time, and I still reside in Maine. And I did a lot of research and decided on a specific provider within that group that I had heard a lot of great things about. So we had an initial consultation with him. They then ran some blood tests as well as a semen analysis for my husband. And really nothing came back that was overly alarming, and really kind of why we weren't getting pregnant was inconclusive. But because we had been trying for 2 years, it was decided to proceed with kind of the first step in the fertility journey, which is an IUI, which is an intrauterine inception. And really an IUI, so I think the chances of getting pregnant per cycle are around 10%. An IUI really raises the chances, not by a significant much, maybe up to about 20%. And really what that is the good old turkey baster method. So your partner would go in, provide the sperm sample. They would then take that and put that into a syringe. And then how it increases is they place the sperm directly into the uterus during your prime ovulation. So it does increase, but it does not have as high of odds as kind of more the traditional IVF route. But is often required that you do that prior to moving on to in vitro fertilization, because it's really just an insurance requirement. And depending on your insurance, we were required to try it once. IUI unfortunately was unsuccessful for us, and so then we moved on to the IVF process. The IVF process is incredibly amazing and is quite involved. It does involve hormones, including estrogen, to prepare you. Really the first step is to kind of overstimulate your egg production so that they can complete an egg retrieval. And then, there's a lot of steps involved in that. I will do a separate video that goes into more detail about IVF. But really kind of where I'm going with all of this is, and I will say there are not a lot of studies out there. Something that I really want as an advocate, as somebody that has been through fertility treatments and now breast cancer, to really look more closely at is any kind of connection between women that go through IVF and breast cancer rates. This is something that is being studied. And again, there's no conclusive evidence to support that those that go through IVF have a higher incidence of breast cancer. But again, there's a lot of studies out there that are looking at this. I have no regrets about going through IVF. Unfortunately for us, I actually got pregnant twice with IVF. The first time I did have a miscarriage, which was incredibly difficult, which again, I will talk more about. But ultimately, the second time I had a full-term pregnancy and had my beautiful son, Jack, and feel so incredibly lucky and blessed. Um, I was diagnosed with breast cancer when Jack turned 1. And interestingly enough, when I was first diagnosed, and this is very standard, especially with younger folks that are diagnosed, is they do a full genetic testing workup. And if that hasn't been offered to you, it's something you should absolutely do. On the surface, my family did not have a significant history. And so we really anticipated nothing coming back abnormal. Well, it turns out that I did have a genetic or abnormality, and known as the CHEK2 mutation. And I'm going to post some information on this video about where to read more about this. CHEK2 is definitely becoming more broadly studied. It is certainly not as well known as the BRCA1, BRCA2 mutations, which put women, specifically BRCA1, at a much higher risk of developing breast cancer, also ovarian cancer. The CHEK2 mutation is a little different, and it can affect your cancer risk. And it's not just for breast cancer, but kind of the way a CHEK mutation, it's a genetic abnormality that can increase the risk of developing certain cancers. And the CHEK2 gene, or checkpoint kinase 2, it helps to repair DNA damage in cells by producing a protein called CHEK2. So everybody has this. And when the gene is working properly, it can help suppress cancer development. However, if you inherit a mutated CHEK2 gene, you have a higher risk of developing cancer if too much DNA damage occurs in a cell. And so I was found to have this CHEK2 mutation, and it really can affect your cancer risk. And so ultimately, just to kind of give you some stats, if you have a family history of breast cancer, which as we kind of dove deeper, we do have a increased risk of breast cancer. There were some breast cancer cases on both my grandmother and grandfather's side. And so it puts you at an estimated lifetime risk for breast cancer of about 28 to 37%. So when I found this out, I was already in active treatment, and certainly this didn't change any course of action. But I will say where this conversation did change my thinking was, so I was diagnosed with 3A breast cancer. So I did have lymph node involvement. I did not have any cancer in my left breast. However, in my right breast, so when we were having conversations of surgery, it was a single mastectomy was there. They never questioned that had to happen with the right, but with the left, I was really kind of given that option. Now with a CHEK2, that really changed the conversation. And in talking with a geneticist, as well as my oncologist and breast surgeon, it really was decided that I should move forward with a double mastectomy, because even with having a single mastectomy, it does increase your chances of getting an additional breast cancer. So that made that decision a lot easier. The other thing to note about a CHEK2 mutation is it does increase your risk of colorectal cancer. It puts you at about a 5 to 10% lifetime risk, prostate a 4% risk, and male breast cancer, which is still being studied, and the risk isn't totally known. So I think, this really goes back to the conversation of really, knowledge is power. And so many people in my direct family, so my mom and my sister were tested. My mom was positive, my sister was negative. So now my mom is being followed more closely. And then I did have cousins, first cousins that were tested. Some were positive, some were negative. Although it's scary to find something out like that, I also feel blessed in a lot of ways that this was discovered, because now people in my family that know they are positive, they recommend that they be followed more closely with mammograms, as well as in conjunction with that, a breast MR, which is a difference because generally the standard screening is a mammogram annually once you hit 40. With those with a CHEK2 mutation, they recommend that in conjunction with a breast MR, which are obviously a lot more sensitive than a mammogram. So my family is following those recommendations, but going back to IVF, when I was going through the process, I was on estrogen pills for a number of years, and my cancer happened to be strongly ER positive. So whether or not there's a direct link, it's hard to know. But I do feel, because I was doing regular breast exams, my cancer did grow in rapid succession. So I think something that I'm hoping to advocate for is when people are approaching the conversation of IVF, that sort of the risk be looked at from an overall perspective. And I think it raises the question of, should more in detail genetic testing be done for women? As I said, if I had the CHEK2 mutation and found that out prior to IVF, there is a way to do hormone-free IVF that probably would have been an better alternative for me. And again, nobody's fault. I didn't really have a strong family history. But as I've kind of started to really think about all of this, there may be a connection. And so it's really just kind of bringing into question, what can we do more of to keep women going through IVF safe and ensure that, we're covering all bases. So that is something that I'm hoping to advocate for and look to kind of bring awareness so that folks are aware of that. As I said, I will post more information about the CHEK2 in case you're interested in reading about it. And, I think with any genetic mutation, it's just very good to be in the know. There's also some studies that are going to be coming out with CHEK2, and so I'll be following that closely to hopefully get on a clinical trial so that as things change, I can be in the know, and more importantly, keep my family members in the know who are in the prevention phase. So again, it is, I don't regret my IVF journey at all. I just wish I had more information when I was starting my IVF journey, because really the focus is having a baby and that being the outcome, but there are a lot of other things to consider. And then I also think about the fact that if I hadn't gone through IVF, would my tumor have grown that quickly? Would I have felt it before it metastasized? So in a lot of ways, I feel like my son saved my life. But I acknowledge and recognize that I feel there is more opportunity to more closely screen women that are starting the IVF process. So I don't know where I'll get with that, but I think that's something important to put out there and important for those to be aware of. So at the end of this, I will provide some additional information about CHEK2 so that you can read more. And if you have questions, feel free to comment and I'll do my best to answer. So in the future, I will talk more about my IVF journey separate and apart from this, because I know anybody going through that is incredibly overwhelming. And as I said, we had a very positive outcome, but it was a journey to get there. And so happy to provide any information that could help those going through that. And then additionally, for any of you that are newly diagnosed, if genetic testing is not part of your clinical journey yet, I would strongly suggest talking to your oncologist about genetic testing, if that is relevant for you and your diagnosis. I think at the end of the day, what I've learned through this is the more knowledge we have on our side, the better the outcome, and the more proactive we can be, the better the outcome. So thank you all for listening. I will be posting again soon. I am going to bring my husband into the conversation because I know that, you know, as part of kind of any fertility or cancer journey, those close to you, your partner often being the most, are really affected and have a unique perspective. And I think can bring so much knowledge to this community and support, because it's not just the patient going through it. Each person in your life is affected in different ways, and are a really important part of this dialogue. So talk to you all soon, and thanks for listening. And don't forget to subscribe.